Okay, welcome everyone here at All Saints and online. Keith, thank you so much. Keith Holman is the man behind the camera. And Manny, oh no, Manny's hiding. Manny Carrillo is in the sound booth. We couldn't do it without either one of you. And in fact, everyone turn and wave to the camera. Wave to everyone who's joining us online. It's good to have everyone here. I gotta catch my breath. Whew. So it is wonderful. We're coming to the third of 4 parts of our forum series on public health. Just a quick review. The first Sunday, we really looked at that work public. We had Dr. Peter Mancall from the USC Department of History and Anthropology here, and he really went back to colonial times, and particularly the relationships of the colonizers who came from Europe with the indigenous people, and looked at that tension between the common good and personal gain, and who was seen as included in the common good and who was not. Then last week we had Linda James Myers joining us from Columbus, Ohio, and talked to us about health not as a system of sick care, but really drew on the wisdom tradition of African deep thought to talk about what does health mean in terms of the interdependence of all living things, and can we really speak of healthcare in this country when there are fundamental things in the founding of this country that are wounding and exclusive, that we still base our society on, and drove us into that area. Well, today we're going to put these two terms together, and we're really going to look at, okay, what happens when you put public and health together? And we really couldn't have two better people in the Pasadena San Gabriel Valley region to join us in this exploration. Want to first welcome Dr. Ying-Ying Go. Dr. Go is the Director of Public Health and the Health Officer for the City of Pasadena. As the city's Director of Public Health and Health Officer, Dr. Go is responsible for the overall planning, administration, and operation of the Pasadena Public Health Department. In this dual role, Dr. Go also provides medical supervision and direction for city health services and programs, and has the authority to declare public health emergencies and quarantines. So she really hasn't been doing much over the last year and a half. So can we just first of all just say thank you to Dr. Go for everything that she has done during this pandemic? Thank you. And there's a little background. Prior to appointment as Director of Public Health, Dr. Go served in various capacities at the Pasadena Public Health Department, and also as the department's Medical Director for Programs and Research. Her professional experience includes clinical pediatric practice, management of a California Endowment Task Force to improve healthcare access and quality in LA County, design and implementation of a case management program for seniors with chronic conditions, and research to improve nutrition and physical activity for youth. So, just that. So, and then Sheri Bonner, a longtime friend of All Saints Church, has served as the president and CEO of Planned Parenthood Pasadena and San Gabriel Valley since 2004. And I think one of the things that we all sort of instinctively know, but maybe kind of forget because of the way that you all have done your job, is this has been an extraordinarily hard last 5 years for Planned Parenthood. And so can we give Sheri a hand for just the amazing work that she and Planned Parenthood have done, just defending healthcare for all in our region. So thank you so much. Sheri was the Chief Administrative Officer at Planned Parenthood affiliate of San Diego and Riverside County before she had this position. And this year, is this true, you celebrate your 30th anniversary with the Planned Parenthood family? Okay, thank you. Yay. Wonderful. So you sort of have heard what it is that we're talking about, and what I wanted to do, and I think Dr. Go will start with you, really to sort of start off and say, let's sort of lay a groundwork. What is your conception of public health? How has it changed over time? And specifically, what have you learned and what are we learning from the last 18 months of pandemic here in Pasadena?
Thank you. So much is the answer. It really does feel like things have shifted dramatically from before, from about 18 months ago till now. But in the same vein, along the same vein, our conception of public health is the same, in the sense that we've always really recognized that our public health system is not just the public health department. We're just a local governmental agency with very prescribed funding streams and very prescribed services, and then very, very broad authorities under the California State Code, under the position of the health officer. So there's certain legal authorities that reside in that seat. But we have always functioned, since I've been leading the organization, knowing that our ability to make public health improvements in our community is really based on all of our partners, including healthcare providers, including organizations like Planned Parenthood, including our community-based organizations, many social organizations, our faith-based partners, who are all part of this public health system that we need in order to make health improvement. And that couldn't have been clearer than, or highlighted more clearly than through the pandemic. As you can see, there are things that we could do. We shifted all 140%, because we've grown, of our resources from all of the things that we do to pandemic response. And yet, with all the authorities where I've issued 40 plus legal orders, we expanded our epidemiology team ×3, our nursing and case investigation team even more than that ×5, and even with all that and the orders and the communication we provided, so much of the work has to be done by other agencies, certainly governments at other levels, political entities, but also the cooperation that we needed from individual residents, because I can issue an order, but if it's not followed, then we don't have the benefit of stopping disease transmission by everyone complying. And I think our businesses and our schools and all these institutions, they are all part of our public health system because they were the ones who were taking and implementing those steps to keep us safe. And of course, we've had variable response, and you can see as a result, disease transmission happening where we were either unable to comply or not willing to comply. So I think that's my overall thoughts about what public health is and how it's changed. Over the last 18 months, I think there are a few things I just wanted to mention that we've learned. First and foremost, it could not have been more amazing or revelatory to me to see the commitment and passion of our public health workforce. And when they were needed to step up and to do this for a year and a half and continuing, the amount of endurance, commitment, really what they've done to make personal sacrifices as they're living through pandemic themselves and impacted and losing family members to COVID and facing everyday challenges. They were still, first and foremost, public health service providers and serving our community. And so that was one of the greatest lessons that I've learned. And I also saw that beyond our city, of course, we have a very strong system in California of health officers. They're required to be MDs, and every jurisdiction in the state is required to have a medical doctor serve as a health officer. And under that leadership, this is how we can function as a public health system in our state. And to have that through 61 jurisdictions, 3 cities, we're one of the 3 cities, and the rest are counties, and then to have the support at the state level to be able to do the work that the science-driven work to protect public health was really, really one of the, I think, key things I learned about how important it was, especially looking at other states and what happened in other states, where the political system, and there's plenty of politics here, from the state level down to the county levels to the city levels. I've had colleagues who left their positions because of pressures and threats, but also from the politicians themselves, really countering what we were trying to do to protect public health. But I think that overall as a system, we could really see that in California, we were able to do better overall than a lot of other states that didn't have that strong system in place. I think I learned really about where we are susceptible, and I think this is really important to think about for the next time this happens. And there will be a next time. I hope it's not in my lifetime, because I'm a little tired. Really what I think about what my children, particularly my youngest child, I think it's been so impactful on his view on life, and it's been hard to try and get him used to not thinking about COVID. He's 7, it's just a very, I think, impressionable age where his lens on like how you socialize and how you, it's really been impactful. So I hope this doesn't happen again. But I think that we really, the weak points in our system include where politics overrides science. And I think, I'm sure you all, it's very obvious, I think, to everyone, where our public health authority is getting attacked and dismantled locally. There are, around the country, legal attempts to try and reduce the authority of public health officials in favor of elected officials. And it's very, very intentional here in California that the health officer is not an elected position. It's not a political position. Of course, this tragedy of federal leadership that was anti-science, and how much that really did impact the number of lives that were lost, frankly. And then the issues that we have with short-sightedness and short-term investments. And so we see this over and over again, repeated in public health, where when there's a crisis, we get a 2 to 3 year grant infusion of grant dollars, and then it goes away. This happened with H1N1. And we expect it fully to happen again. I hope not, but we're concerned. So, that's the kind of short-sighted infrastructure that we need to, I think, overcome. I hope that we can overcome so that we can be better prepared for next time. And then just to mention 2 more things for the weaknesses that I've learned about. Certainly our long-term health care facilities, the way we house our seniors who have medical needs, especially those who are on public insurance, is a unfortunate, I think, really, just weak point in our society that we need to improve on. And then the racial inequities resulting in deadly outcomes that we've seen, and not just race-based, but also really cultural and socially based. So we see our lower vaccination rates in certain groups where there is misinformation and disinformation that's perpetuated, and when you belong to a social group, your decisions for all of us are less individual than we think, and more based on our friends and family and groups that we belong to and the need to belong. So those are just a few of my thoughts.
Thank you. Thank you so much. Before I kick the same question over to you, Sheri, a couple things. First of all, and it seems particularly appropriate for now, I know we have coffee and tea and things that we're drinking. If we could keep our masks on and practice what I call the dip and sip, which is that would be great, just again, so that we're being really careful, because we do have, maybe not in the room, but in here we have children under 12, and we really want to make sure that everyone is safe. And then also, if you are not here, we're going to have a chance for questions from everyone who's here and also online. The way, if you're watching us online, use the same number we use for text prayers. It's 910-TEXT-ASC, and the numbers for that are 910-839-8272. 910-839-8272. And if you didn't get that, just go to the live stream page, download the liturgy, and look for the text prayers, and that number is there. And now, Sheri, same question to you.
Well, this isn't on, right?
Here, let's switch it on.
Hello.
This is switch. That one's definitely on.
Okay, this one's on. Hi, everyone. My pronouns are she, her, hers, and I'm really happy to be back in the forum with all of you today. And I just want to do a hat tip to Mike for all his partnership and mentorship with me, and then also to Dr. Ying-Ying, who, when she came here in her position, she came on our board at Planned Parenthood for 8 years. So we had an opportunity to build a trusting relationship, and I think that as we have weathered this pandemic, it has really proved fruitful. To back up, I think of Planned Parenthood as being in the space of public health sort of always. As we think about keeping people well is a lot about prevention. And when people come into Planned Parenthood, they are getting birth control, they are getting STD tests, they are getting cancer screenings, mammograms. We do PrEP and PEP, which is, those are acronyms that are about HIV prevention. So you can actually ward off the possibility of getting HIV by upwards of 90% by taking these particular pills. So there's a lot that we do. We also provide care for transgender folks. So I feel like we've been in this business of prevention and wellness always. And as I think about what's happening in the state of California and really what has become possible through the Affordable Care Act, although it's on a very slow roll, is that providers can get paid for keeping people well. And we are well positioned to be in that space. That's not happening yet, but I think the fact that that the money is starting to follow how to keep people well, whether it's vaccinations or screenings, that's a good portent for the way that our healthcare system is going. But again, it's on a slow roll. It's called value-based care. Also, I think abortion is such an important part of public health, that people have access to abortion services. I think it positions our communities well and the health of our communities when people have the ability to decide whether and when they want to parent. And so I think that is an important part of what we do. And for many of the communities that we serve, which extends out through the San Gabriel Valley, we are the only abortion provider in their community. Okay, so then we have the pandemic. How many of you have those years are just kind of erased, like the last year you can't figure out, did that happen last year or 2 years ago? I'm having a lot of trouble with that. But I think what we have learned is just how resilient we are. When the pandemic hit, we quickly, sort of overnight, it may have taken a few days. I see Julianne Hines here, who worked with us before, and she went through that with us. But we very quickly moved all our patients. We were 80% seeing our patients through telehealth. And so we talk about how amazing the people in our space and do this work are. I mean, that is a pretty abrupt change in operations to go from seeing people in 3D, as I call it, to seeing them over a screen. But we did it. Just so you know, like how things are now, we're down to less than 20% telehealth visits. So people really do want to come in. But at the pitch, we were at 80%. So the other thing that happened is when the vaccines became available, we started providing them to our patients, to the family members of our staff. We started with staff, to the family members of staff, and how rewarding it was for us to see, a staff person's parent who's, 70 years old, who's coming in, who's a monolingual Spanish speaker, and just so thrilled to be able to get their vaccine for free in a way that was easily accessible. So we started with our staff, and then and then we started talking with Dr. Go, and she said, "I have vaccines. Do you want them?" And we said, "Why, yes, we do." And with that, we started vaccinating the community. So anyone, it didn't have to be our patients, could come in and get a vaccine at any of our health centers. And so far, we've provided more than 5,000 doses of vaccines. I think that's a pretty good impact on the health of our communities. I think what has been important is that, since 1933, we have deep ties to this community and to a diverse range of organizations. And so as we have done this work, as we do our work, I think public health is a lot more than just healthcare. We have partnered to ensure that our patients have access to, if they're food insecure, if they have housing needs. We're really fortunate to be in this community where those kinds of things have a tremendous impact on quality of life, as well as things like pay inequities. That has a tremendous impact. We have been in the business of providing vaccines now for almost 18. No. So I don't know. March or April, yeah, March or April. So a long time. So we're really thrilled to be a part of this network of local partners.
You know what? Okay, wait, we got this right. Okay, I think we're set now. So first of all, just thank both of you. And it's a lot of things strike me about what you said. And one of the things that we've found is that during this pandemic, one of the things that I saw happen a lot was we started working together in new ways. And it was really moving to me here in Pasadena to see, and like the partnership that the two of you had is an example of that. And there can be such a tendency when we are under threat to circle the wagons and think about ourselves. And I got to say, particularly in the nonprofit community, I didn't see that happening a lot. I saw people checking in on each other and saying, how can we help each other and how can we all really be in this together? Some of the language that we began to use around this is people, started to say we're all in the same boat. And we said, well, actually, we're really not. We're all in the same storm. And we're in radically different boats. And you named some of the inequities that are that. But is there a way that we can tie our boats together so that we can survive the storm, maybe learn from each other? And I saw so many areas of our Pasadena, San Gabriel Valley community doing that and reaching out to each other. And so, just thank you for modeling that, both of you, in a really public way. A theme that's been going through the last 3 weeks is how do we balance individual rights and the common good in conversations and policy around public health. And something that struck me as you both were talking was divisive politics being a part of healthcare is certainly nothing that is new to you, Sheri.
No.
And I wondered, you were on the Planned Parenthood board, but I'm wondering how much of this was a new development to the degree it happened to you. How do we balance individual rights and the common good? How do we do the work we need to do when really divisive politics threatens to overshadow the work of public health?
I don't really have an answer for that. I think this is the hard stuff when I think about the work that Planned Parenthood has done in the space that we've always been in, which is advocating for individual rights to abortion. We've always advocated for those individual rights. And I think that when there is an implication that affects the health of a population, then we have to rethink that. And then what that means is that we have to ensure that our public and our communities are safe. So I think there's a trumping at that point when you have communities who are implicated by the health of an individual. So I believe strongly in mandates. I think they're really important for the health of our communities. And I believe strongly in an individual's right to choose abortion services. So I think we can hold those two thoughts in the same space.
I agree. We actually routinely ask people to temporarily limit their individual rights to protect others. So before the pandemic, I would frequently issue to someone with tuberculosis or salmonella or other communicable infectious diseases, measles, when we had our measles outbreak, that they would need to restrict their movement for some time until they weren't infectious to others anymore. And during that time, we would support them. With tuberculosis, people have to get treated for 6 months to 2 years. And we go every day, or now we have some video technology, we can do real-time observation that they get their medicines and they take their medicines. And that is for their own well-being as well as the well-being of our community in general. And so it's not incompatible with our society where we can have this idea that there are some things we have to do as individuals to help each other, and everyone benefits. And I think the real difference here, I think, is for vaccines also, of course, there's always been a small number of people who have been vocal and really prey on people's fears in an unfounded way to try and prevent people from getting vaccinated or not requiring people to get vaccinated. But I think I really do think that the way we share information digitally now is really a problem, can be a problem for spreading and perpetuating disinformation, and we really need to look at how that's a public health risk that we need to think about how we can regulate or change.
Yeah, I would just add, using the example of our staff, and I think many organizations, companies went through this where we, complied with the state's mandate for vaccination. And we had a certain number of staff who said, I'm not going to get vaccinated, a certain number who said, I don't know if I will get vaccinated. And, then you get to that day where it's the deadline and you can't keep your job if you're not vaccinated. I know that our HR department spent a lot of time in conversation with those staff who were vaccine hesitant. And I think it was through those conversations that people were able to move to a place that they could see that that was important. And then at the end of the day, are you willing to lose your job? So I think mandates matter.
And one of the issues that I've just seen keep coming up is the issue of trust and authority. It is, and because there are some communities that I have seen, particularly communities of color, that have, in part of their history, vaccines being used in really destructive ways in their community, and that sort of being, so there's a level of mistrust there. And then there's also okay, well, what news source are you going to trust in? What do we give authority to? And it feels like we're increasingly polarized. To the point people say, All Saints Church, well, that's that liberal church. And so if I'm, belong to a more conservative church, am I going to listen to anything All Saints has to say? And what I felt, I didn't know where it was where is the place where we can have the conversation about trust and authority, and how do we start to build that back? I do not expect you to have an answer to that question. That's a really hard question. But where do you see that impacting those issues of trust and authority? Where do you see that impacting the work that you do, and do you see maybe a first step somewhere to moving forward?
So I do think that there's something we can do with education, with starting in childhood, with understanding science and the basic tenets of science so that people can make decisions that are separate from what they're hearing, using what they observe and what they learn. And I think that that's missing and gets overridden by the political and sort of cultural fear-mongering. And I did want to correct one thing, that really vaccines have never been an area where there's been medical, I think, abuse
Thank
of
you.
racial groups, but certainly a history of racism in the medical system,
That's better.
including studies, where we've
Right.
differentially, where we've withheld treatment from African Americans, for example. The establishment has done this to their detriment. But I think, so that's just one area where I think we can do that. I remember learning about, the responsibility to vote and what it means to have freedoms and having these discussions in school, in my public school system in Ohio. And I think that those are really important parts of education that need to be available to our children, our school children.
Well, and what you did just there, because I unwittingly gave a piece of misinformation, and you said, no, that wasn't right, what you're thinking of is this. And and the way that you did it was just gentle and nice. And so, no, seriously, and that's like, that, to me, that's a model of what we can do, because you didn't roll your eyes, you didn't call me stupid. What I said was wrong, and yet what you did was said, no, not that, I need to correct you, and this, and then you sourced it. And so to me, that's an example of just daily life of what we can do. So.
Yeah, I mean, I think what's changed is that violence has come into our political system and at the highest levels of our government. There's now violence is okay. And I think that is sort of a game changer for people where wanting to be able to sort of reach across the aisle, we don't see that modeled in Congress anymore. But that is the place where the magic happens, is where people in conversation, they're willing to be open. I think there's a lot of education that we can do in the schools around decision making, around civics and government. And when people have education, it can make a huge amount of difference for them. I think of in terms of what we do at Planned Parenthood is for many people coming in, it's their first time they've come in of their own authority to for their healthcare visit. And we do everything we can so that when they walk out there, they feel like they have had a real visit with someone such that when they walk out, they know what a healthcare visit should look like. And then because they should be empowered in that visit. And I think for many people, there's really an inequity of power. So I sort of went off on a tangent, but I think it really, I think there's this cycle. The violence piece is going to be hard to come back from, but having these conversations, being in a space, brave leaders like you and All Saints, creating those spaces for people to talk, because ultimately I think we're all want the same thing. We want to have happy, quality lives for us and our children and our grandchildren. Like, that's the beginning and that's the end. And certainly we can all meet in the middle on that.
Well, and it's so important to bring violence into this. I mean, bring the topic of violence into this. Let me be clear. Yeah, that's right. Yeah. And like I forget if it was the CDC or whoever it was, started talking about gun violence as a public health issue. Yeah. And just even in some of the conversations we're having this morning, we're identifying food, housing, pay inequity as public health issues. One of the things we struggle with here at All Saints Church is what's sort of come to be termed as work-life balance. That's a public health issue, and in fact, as we had vestry conversations this week about, we passed a draft budget, and we're looking at, one of our assumptions is we're not going to go back to the way things were. Things are different, and yet there's this gravitational pull of going back to the model that was before. And All Saints is a challenging place for work-life balance, and that has not been a strong suit for us, for our staff. Yeah. And so, what about things like that? We think like we've just had hearings about Facebook and Instagram and what they're doing to us, particularly to women and non-binary, but not exclusively to people. Where do you see the impact of that on public health, and how do we widen this conversation?
We haven't had any work-life balance for at least 18 months, and we're trying to get there because people are getting burned out. And we actually are losing at a time when we have a bit of infusion of funding, we can't hire. Everyone's having trouble hiring. And we can't run a pandemic response without the people. And we're losing our nurses because they can get higher pay and better work-life balance and they have many other options. And so, so it is a challenge for us as well, although we do recognize how important it is. That's one step, but we're trying to incorporate that for us. I think for our community in general, we are really focused on, I think there's some fundamental needs like housing security, food security, safety, that are the things that have to be fulfilled first. And addressing work-life balance, but also support for, childcare and trying to offer those things to the basic needs that people have, that we see in our department. We see that as we work with our communities that we need to fulfill.
Yeah, I think that so there's a shift that's happening. I think that it will continue. I don't think it's just the pandemic, but I think it's really brought about sort of the voice of the worker that we haven't had in, I don't know, not a historian, but it seems like a long time, where folks in the workplace are actually speaking up. And they're saying, I think I should be paid more. I think that I shouldn't be asked to not have 2 days off in a row. And so having workers have more of a say in their organizational life, and our diverse people of color having more of a voice, I think that's going to make it better for everyone. I think it's an evolution. I think it's going to take time, but just my observations in my workplace, I can see we're very much engaged with our staff in the things that they want and need, and we're listening and we're making changes, and we see they're happier. So it's part of it is listening, and the other part is saying, we're not the commanders here. We're all together, and we're going to work together on this. So.
Yeah, and I'm also concerned about how short our memories are. Because we remember early on in the pandemic, everyone, we were about to have parades for grocery store workers. And we've really forgotten about, we're not really concerned with how much they're making right now. We went from saying, these are heroes, these are wonderful people, to, we're back to normal. And so, frankly, part of what I'm finding is the gravitational pull of the way things used to be is so strong. I don't know if it's those neural pathways that are cut in our head, that this is what's familiar. And so, because you would think that Fight for 15 would be okay, now we're on to what's next. Can we fight for an actual living wage? But I'm not really hearing those conversations. And I don't know how much of it's just that we're all just too exhausted, or if it's just sort of that, we've sort of moved on.
Yeah, I think when you have scarcity of workers, things change. Mm-hmm. So, and that's what we are seeing in the healthcare arena, and I think when we look at the population changes, we're going to continue to see this.
Couple other things related, and then I want to sort of open it up, and we're getting some questions in text. And we've talked some about how health conditions and outcomes can differ greatly depending on social location, and we've named some of those things. What are some of the leverage points? Sort of where do we start in eliminating disparities that would have the greatest positive impact on public health? As you said, it's sort of okay, we'll get to work-life balance. Not that that's not important, but there's other things. So if you had to point to one or two things that are foundational that we kind of need to push on that will have the greatest impact on public health, what do you see them as?
So there are people, researchers, who are systematically trying to answer that question in a modeled way based on data. And so there are some models that lift up some areas that might really be high yield. And those include universal preschool, so childcare and early education, and income security, and even some types of positive adult modeling programs or mentoring programs with youth. So those positive supports in our community that start when you're young to help push back or buffer against those negative forces and the trauma, the various kinds of trauma that people experience that lead to a life of, that's on a less healthy life, on a track that's less healthy. And so those are some of the areas that are actually thought and that people are trying to demonstrate we should invest in.
So when you say income security, are you thinking of like things like a universal basic income?
I'm not sure how to do it.
Yeah.
But that's one proposal
that's
that's
on the
been put
table.
out there, yeah.
Oh, that's fascinating. Thank you. What do you see, Sheri?
Well, everything that Dr. Go said, what we're doing is doing more work in communities, reaching out to communities that historically have had have had more barriers to healthcare, and being in partnership in people in their communities with educators. That's one of the things that we're doing. We also have a new, very big foster youth. We call them Youth in Care program that has online education. There's a lot of transitioning that young people in foster care have, where they go from home to home. So ensuring that they have access to basic information like relationships and sexuality is very, very important, including for the people who are stakeholders in their lives. And then having that really warm handoff into services. And someone who guides them along the way, because we think our youth in care, we have more youth in foster care in LA County than in any other state in the nation.
Wow.
So it's a really big problem here that I think we're really happy that we are part of the solution for. So, and everything that Dr. Go said, and I think that a basic living wage is just going to be imperative for us.
Yeah, absolutely. Thanks. I want to turn it over here. Actually, John raised his hand first, and we've also got some text questions. So I'm going to do Phil Donahue here and come into the...
Hi, thank you so much for your presentation. I think what Mike said, that trust is a big issue, and you guys have pointed out science-based learning is important, but medicine doesn't have a good track record in that, because things like nutrition has no effect on the human body was a belief, in the 70s and 60s. It is now obvious to most people that it does. Eggs are good, eggs are bad, whatever. So, coffee's good, coffee's bad, depending on, and that's kind of apocryphal. So in terms of the separation of the people who are, how do we join the people? How do we create an inclusion for the people who are non-science and their fear? How do we make room for them within our system? And I'm thinking of like what we do with, I could not have imagined growing up that there would ever be a world that people weren't smoking in the classroom and things like that. It's too hard, can't be done, but somehow it's done. Wheelchair access. So to me, if we look at the issue, what we're separating, not as something to be afraid of, but something to include, I think I would like to see some action or some thoughts around how do we treat these people who are non-science or have their own position, and include them. Is there a way? And I know it's difficult.
Thanks, man.
There have been so many challenges in messaging science. As a physician, I remember seeing patients and thinking about how patients will often come with their illness and expect that there's a clear treatment that's going to work. And you're actually navigating, some data, partial data, or lack of data, or strong data, depending on what the situation is, and trying to do the best that you can, and it's often not clear-cut. And on a larger scale for public health, we've seen that happen, where we've said, masks aren't that effective, and where really what was meant was, please don't wear a mask right now because we need them for our healthcare workers, and they're at the highest risk, situation, and then the distrust that or people were able to pounce on that and use that as a proof that you shouldn't trust public health, and then with the helping people to understand that if initial studies shows one thing, and then the changes over time, like how useful is remdesivir and who is it useful for, and that over the course of the months it changed, and for people to understand that it can change, it's hard to accept that. Like, we think that we should have answers today, and even with the question of booster doses, it was hard because I would like the messaging to be very clear and just that everyone should get them. But that's not what the CDC is saying, because there isn't a lot of data right now that the benefits outweigh the risks of getting COVID once you've gotten your first 2 shots for the younger populations. So there's going to take time. And in the meantime, people are thinking, well, why aren't you telling me what to do? And why can't I trust you? And then if we put out a message that ends up being wrong or not entirely correct later, then there's more distrust. And so it's a very difficult proposition to try and do that. I think that one key here that is so revealing to me is that the people who are, for example, like the pundits who are putting extremist views out there, such as promoting ivermectin, with complete lack of evidence that it's effective in any way against COVID-19, they actually have personal gain that they can get from there. So one of the tools we used to use, and I don't know how effective it was with children, and talking about their food environment and why there are so many unhealthy foods around them, is because it's being promoted to them actively. Same with tobacco, because there is corporate gain. And that is the situation here with COVID sometimes. But so I've seen the media quite effectively in some circles, but not probably, for the average, most people, try to carry that story or try to promote that, is understanding that some of these radio personalities have nutraceutical companies that they are profiting tens of millions of dollars per year by promoting snake oil medicine, or that they that the they're anti-vaxxers who are on social media who are personally profiting off of other people's harm done to other people by not getting vaccinated. So that is one way that I thought we try to use, even for middle school age students, to help them understand how they can take control of making their own choices to their benefit as opposed to corporate benefit.
So I got a question here online. What can we do to ensure public health gets funds from federal recovery grants and longer-term funding and support for future monitoring and authority to intervene as needed in the future? You talked about the short-sightedness. And I think the what can we do is not just what can you do, what can we do?
Yeah. I think talking to your elected officials at the federal level, state level as well. But I think even in the state budget, the most recent state budget, we were cut out. We couldn't believe it. And the thinking was, oh, well, we're going to do a study now to really evaluate public health infrastructure and see in the next funding cycle, like what are we going to do as a long-term investment. I hope that's what it is, but I think, and there was thinking that there's funding coming from the feds right now for the short term, so maybe the state will fill in later. But regardless, I think continued messaging to our elected officials at the state and federal levels of the need to have ongoing, to shore up the public health system, that will be helpful.
Yeah, that's exactly what I would have said. I mean, elected officials, especially in our state, they listen to us, that matters. And what tends to matter is if you have numbers. Like, that's how they keep score, is how many people are calling, how many people are agitating about this or that. So I think that's an important piece of this for sure.
Well, and I think I'm going to move into the camera here and say to those of us watching online, there's times in California, like I can tell, it's important for me to write Judy Chu about stuff, and I'm not telling Judy Chu anything she doesn't already know, and it's still important for me to do that. If you are watching and participating in this in a place where there is considerable political pressure not to provide funding to science-based public health outcomes that we know work. Please step up. And also let us know of those of us who are in states like California, and particularly in districts like this, how we can help you, because it really is something that it just needs to happen nationally. And of course, in that, please remember to tell your elected officials how important continuing funding for Planned Parenthood is, because we can't just take a deep breath and assume that it's safe now. We've got to just keep going with that. Other questions from here? We got a couple more. Yeah, here.
For public health organizations, what's the relationship or even maybe responsibility toward the homeless? A couple times you've mentioned housing and security. Like if I meet a homeless person and after time kind of establish a little bit of eye contact relationship, is there anything that public health does for somebody, and is there something I could do for that person on that corner?
Yes. There's so many social issues that are all public health issues, but only a small portion that we get funding to work on. And it varies from place to place, of course. And in counties, it's not necessarily the case, but there is opportunity to really be integrated across many other county services and funding streams with a public health department. For us, we're fortunate we have some funding we have two teams now. They're street outreach teams that are a multidisciplinary team, including, we run it out of the public health department, but we have firefighters on each of those teams. And one of them is from city general funds. The other is grant funded. And they go out to the streets, and their job is not the same as the police-based team, the HOPE team. Ours is called the PORT team, and you can give us any referrals, and we will go out and look for people, and we will work with them. We'll talk with them. We'll provide them with blankets, socks, whatever they need. We will provide them with a vaccine if they need it. If they're not ready, we'll come visit them again. And we will connect them with we have a laundry, a lavame, we have a shower and laundry facility at Jackie Robinson Center. And so anything they need, our team often will help them with getting IDs or Social Security benefits, whatever they need. Our team is there to help and develop this kind of relationship that is a supportive relationship, because usually those people aren't immediately trusting us and also not ready to be housed yet. And if you try and put someone in housing who doesn't want to be housed, then they don't stay. It doesn't work. It doesn't help them. So you could give me a referral, and I can also give you the number. You can call the Citizen Service Center. That's the 626-744-7311, I think. And they can take that information, and we'll send our teams out.
Well, and I want to put a plug in, because we have a portion of our community here at All Saints Church that is unhoused. Some of those folks are in the Safe Haven Bridge to Housing program. And this team has been invaluable for us throughout the pandemic of calling and really working on health concerns for folks who are, part of the All Saints community. And so just, thank you for that work. We're going to be actually hosting, for LA County Department of Public Health, we're going to be hosting a pop-up vaccine, COVID vaccine morning here, working with Union Station Homeless Services, particularly aimed at those among us who are unhoused, who have not yet been vaccinated, or who perhaps qualify for boosters, doing that. So it's got to continue to be this team effort. And then just one more thing in terms of people who aren't ready for housing and they fall out of housing. Another thing that we found is the number one thing that once people are in housing that keeps them in housing is community. And that's why a key part of the work that we're doing with Union Station and Safe Haven is, and it's easy because when, people they're part of the All Saints community, so of course we're going to keep in touch with each other. But we've moved, and I think Sally's not here anymore. I forget the number of people that have been able to be moved into permanent housing. And one of the best things about it is everyone who's moved in has stayed there. And that really kind of brings us back to the looking out for the common good thing. Is it's not just enough to sort of say, okay, you're out of crisis, see you later. And this has to do with every aspect of public health. It is how do we continue to build and sustain the web of relationships that keep us from slipping into crisis, or when we do, we're there to catch each other. And how do we continue to cultivate and build that awareness? I want to give each of you a chance to sort of I just preached my sermon, so I'll give each of you a chance to sort of say a final word, and then we'll sort of move on.
I really appreciate having the opportunity to meet you all and have a conversation, and we're here to serve. Our health department's here to serve, and we want to continue having these conversations. I do have an ask.
Yeah.
We've reached out to many different faiths during the COVID pandemic and asked to partner, and we've had a variety of responses. And I think where you have the ability to reach out to other faith establishments in our community, for example, we've been at the Buddhist temple, we've been in an Armenian church, we've been at our African American churches, and we've seen that make a difference. For example, in our rates of vaccinated African American residents, it's been steadily increasing and now exceeds that of white men in Pasadena, and for both men and women who are African American. And so when we think that's directly a result of those communities working in their community to promote vaccination, not us.
Right.
So there are certain, I think, faith-based organizations where their communities, I think there's opportunity for more vaccination and really understanding also even of the mask mandate. And hopefully at some point in the coming months that will be, we'll have more freedom on that one. But with vaccinations, that's going to be the key going forward indefinitely for the future. So wherever you have relationships, that would be a huge help.
Well, and I think probably people in this room can tell you that we've been doing that and we will continue to do that. And so, it has been a help to us to be able to say, this is what the Department of Public Health is saying. It's not just us. So thank you for, giving us the weight behind what we're saying. So, we can say, no, we're following the science. And that's our answer when people push back. So
we're happy to do that, offer that.
Great. Sheri.
I think exactly right. I would love to engage more in what we can do as a community, and I know that the new Kaiser Medical School, their students, I think they have their second class going now in Pasadena, and they are very interested and are putting their students in federally qualified health centers, in community spaces. So they're starting a new community engagement group, and so I'm very hopeful that there'll be another anchor in our community, because I think there's ripples. But if I get to stay on my soapbox, what I would say, and I said early on that I think access to abortion, that's a public health issue, and I think a lot of people don't know that we're not safe anymore in terms of access to abortion. We're fortunate here in California, but there's a law that has been upheld at higher court levels in Texas that basically eliminates a person's access to abortion. And there's a case that's happening in Mississippi that would limit someone's access to abortion beyond 15 weeks. And so we're not safe anymore. This abortion is slipping away. It's slipping through our fingers. It's going to. And there will be states where people will have access. But otherwise, we have patients right now who are coming to us from Texas to get abortions. We have patients from Arizona because the spillover from Texas, they don't have appointments in their state, so they're coming into California. This is a very big public health issue.
Great, thank you. Thank you both. And thank you all, and thank you online. What we're doing now is we've got questions here for conversation. You can stay here and break into groups and have them. You can take them home. Real quick, first, how has your understanding about how our health is interdependent changed during the pandemic? What factors in our society do you see having an adverse effect on your health? How do you participate in sustaining these factors? How are you pushing back against them? And then finally, as we emerge from pandemic and have the opportunity to create new ways of being, how can we use our values of radical inclusion, courageous justice, joyful spirituality, and ethical stewardship to become a healthier All Saints church? What are some of the particular areas we need to attend to? So these questions will be up available here. And then next week, it's going to be our turn. We're going to gather and have some community conversations. Those of you who are online, you're going to get to participate too. And we're going to look at what we've learned over the last 3 weeks and how do we apply it to our personal lives and our life as a community. And then you're also going to get a chance to give some impact on sort of, how do you feel about doing a forum this way, of sort of a series of things. So we're going to have some really great conversations. So thank you, Dr. Go, Sheri, thank you all so much. Thank you. Questions are right here.